When you analyze the health benefits package of any company, you usually find it to be one line item, and that is health insurance. It's counterintuitive in a way because health insurance is usually used to pay for medical treatment when your health is not so good. So it's not really a health benefit. Why is it that companies haven't gone beyond this single line item, and what can they do to actually make health benefit a real enabler for their employer brand? Let's close the loop on this one. Joining me on Close the Loop is the co-founder and chief operating officer of Loop, Ryan Singh. Ryan, before he co-founded Loop, has had a lot of experience in the public healthcare system. And as part of Loop's journey, he's interacted with thousands of HR leaders and analyzed thousands of benefits packages across multiple industries. Ryan, welcome to Close the Loop.
Good to be here, Srini.
Yeah. So right off the bat, why do you think that the health benefit has just been like one line item?
Yeah.
Health insurance.
Yeah. I think it's probably interesting maybe to give some context to this, right? Like the state of health benefits. We talk about this all the time, but I think helpful to kind of remember that's MNCs who came to India.
Yeah.
They had these global benefits packages, and Wipros and Infosys said, hey, we compete with talent. So then it started these big companies, and it sort of worked. All the companies who compete with Wipro and Infosys for talent, who are in the mid-market, then had to offer it. Now, to some extent, I think for a lot of companies, just offering this in the last 10 years was the thing. It's like,
so it's like a par for the course.
I think it was that. I think it was that for a long time, and probably slightly before COVID and definitely during COVID. I think that's when HRs realized this is like, this can be much more. Like maybe our benefits spend can actually engage way more people, do more at the company.
Because you would think that there is an impact if you just offer health insurance as a health benefit. There is an impact that companies have been seeing on the ground, right? In terms of, I think India has become like this big hub for all the non-infectious, non-communicable diseases like diabetes and hypertension. So it's a little odd that, all the HRs that you meet, it's a little odd that it didn't strike them before. Like COVID had to happen for it to become like a forcing function.
Interesting. Yeah, I mean, I think this like pockets of vision have definitely been there. I think a lot of company leaders for a long time in India have thought about the health of their companies. And if you think about a lot of traditional manufacturing sector companies who have doctors on site, I think it is a big part of their employee benefits for a long time, for the last like 15, 20 years to say, hey, like if you have a medical bill, why don't we come and reimburse it? So I think there's like a big diversity to this. And I do feel like some of these more traditional older industry companies, they actually do spend and they do the things. They do look after their employees' health.
I think it could also be that some companies feel like health is a really personal thing, and maybe as my employee, I probably don't. I mean, I'm okay to sort of give them a meal in the canteen as a benefit, or a gym membership if they want to use it. But I really don't want to get into this health zone because they have doctors, they have access to doctors, and do you think that's also something that might have played out?
Yeah, I think so. I think it's also very dependent on the company. I think certain leaders of companies do see their role as like, I am here to drive shareholder value, right? And so I think that's maybe one end of the spectrum. And one is that, to drive shareholder value, I need a healthy, engaged, motivated team. Right? And I think the literature and like the level of understanding, especially in India on that side, of having a motivated, healthy, encouraged, happy workforce, I think we've come a long way in the last 5-10 years.
Because one of the things that you see HR always says that we want to build a strong employer brand, and I think almost every CHRO today has it on as an OKR for them. And it's a bit odd that they haven't thought about the one thing which, if they can actually solve, like if I can help my employee or their father or mother or wife or child get a little bit healthier, then I don't think there's a better connect that you can make. So are you seeing HR leaders sort of change their thinking a little bit?
Yeah, I think so. I think companies choose a strategy as to like what their employer brand is. And that can be related to like their own business model, right? It's like Misho, for example, it's not known necessarily for health benefits, though they have great health benefits. I think it's known more for really flexible work policies, right? And I think everyone kind of knows that, right? I think regardless of your core business and what you're in, I think being caring is sort of like a time-tested, very classic thing, and I think it's just universally appreciated. I just see this as an extension of like nice manager behavior. Like if you're going through something bad at home with health or your parents' health or your kids' health, you kind of want that like leniency and that level of kind of like human support, right? And I think this is just taking that one step above to saying, let's give managers tools to extend at the time when somebody on their team is sick or has this issue.
Correct.
So I see it as more of the same, and more of that, right? It's just like formalizing and putting some policies around just caring, right?
Exactly.
And I think like anyone can adopt that as a part of their employer brand.
So we've seen that, let's say, health insurance is the baseline that most companies have. How does a company evolve from that? Let's say a company wants to do more and improve the health of their employees. So how do you take health insurance as a baseline and then build on top of that? What are the layers that you can add on top of that?
I think fundamentally, you can add lots of sort of bells and whistles, right? Like the whole world of employee health and wellness and corporate diagnostics. I think all of that is great in there, but I think one of the problems is we kind of like throw all of these things at the wall without like a overarching strategy. And so I would
it's like a laundry list of things.
Yeah, it's a laundry. It's like your gym membership, your vision, your dental, your this and your that, your step track, like all of that. But to what end, right? Is it just to have the longest list, which is okay, right? Like if your employees value some of these benefits, there's nothing wrong with that. But I just think the cost becomes a big part of it, right? And so I think traditionally, your health insurance spend as an HR is your biggest area of spend, right? And I think very few providers or vendors in the market have really figured out how to add in value-added services or add in preventative and primary care without increasing costs, right? Or having that be part of the insurance underwriting.
Correct.
I think that's like really where building like a health assurance model is going to be really powerful because it also addresses cost.
It's very practical in that sense.
Right, exactly. Yeah.
So do you think that is it because traditionally, if you look at the healthcare system, not just in India or in the health insurance system, they are just focused a lot on sick care. They're not really focused on, preventive. So I think you mentioned preventive is one of the things that can be added on top of insurance. So is that really the baggage that we need to?
I think on this like enterprise side, I think it's sick care. It's also the norm, right? It's like it's mostly what companies offer. I think certain HRs HRs are a very caring group of people. I think that they anyway do care and they do want to intervene. If you asked 100 HRs like, would you want to prevent unnecessary hospitalizations? They would all like raise their hand and say like, and a few folks would even talk about anecdotal stories of how they did it, right? So I think that mindset is very much baked in. It's baked into the consumer psychology. It's baked into the mindset of just treating sick care.
Correct.
So I think it is prevalent, and I think it's something to work towards. I think it's very easy to convince people though that like there is a better way, right? It's like probably I shouldn't have just a transactional relationship with my doctor. I should have like a continuous relationship.
Correct. So for a HR leader or manager who's only provided insurance plus as a health benefit, how would you define health assurance to them?
Yeah, I think health assurance it's a healthcare services plus health insurance sort of combined in such a way that treats your employee's entire journey of health rather than just paying for their stay at a hospital. Right. It's about can we catch things when they're small and when they're early. Right. I think health insurance is a kind of a system of vendors and companies and doctors who are kind of going to align to deliver that kind of experience where the employee is cared for. Right. It's not that they are paid for when they need hospital care.
So how is health assurance different from health insurance?
It's about the scope of what it's trying to impact. I think health insurance, right, it pays for you to go to the hospital, which is great, right? Because hospitals visits are very expensive. It can bankrupt a family. It's a huge and amazing form of financial protection, right? So I think this is no knock on health insurance, right? I think we should still penetrate health insurance deeply into this country, right? I think health assurance is about saying like, what's the next level, right? Every single day there's so many patients who are steered to the wrong doctor, to the wrong hospital for the wrong surgery, right? It's can we prevent that from happening, right? Health assurance is giving people basically an advocate or a team of doctors and a care journey to basically guide them to make sure that something that could have got caught earlier is, and then it's inherently financial also. Right? There is this financial piece about if health assurance is done right, it'll actually reduce claims on your health insurance. It's something that we as Loop are obviously working on and doing, and I think our approach is providing every employee at a company with 30-second access to a doctor, access to a great specialist if they need a virtual consult, and kind of a care journey to guide them. So if they're diabetic or they're hypertensive or their parent is always claiming every single year, could we provide like more proactive preventative care to those people to make sure that doesn't impact the claims ratio at the end of the year, right? And a lot of our customers who we work with, we are actually able to reduce their claims ratios. And I think CFOs finally see some light at the end of the tunnel. Say, oh my God, these claims ratios aren't just going to keep going up 30% every year.
So, given that there are so many benefits, let's assume that health assurance is implemented as part of a health benefit in an ideal situation. What does it look like for a company that's done it really well? And what does it look like for an employee that's receiving this experience?
I think maybe starting with the company, the conversation about employee health benefits isn't just about here's the amounts your employee claimed at the hospital, here's the amount they paid, here's the tap in which it was paid. It becomes a conversation about I have 1,000 employees, 200 of them are pre-diabetic, and here's what we're doing to fix that, right? That is going to result in like lower diabetic retinopathy or lower diabetes-related claims later, right? That is a whole different story, I think, for HRs to share with management, right? It really shows them taking a whole different level of ownership about employee health and about employee kind of productivity and performance, right? So I think the conversation shifts from like this billing and claims-related sort of conversation to a population health, like what's the health of the population and what are we doing? What are the interventions we're doing to fix it? I think for the employee, hopefully it's like a travel help desk, right? It's like a travel desk for their family, but for their healthcare, right? Like, it'd be amazing if someone's father who needed a heart surgery, it'd be amazing if someone could say, here is the cardiologist in this hospital who has the lowest readmission rates and the lowest rates of mortality. And that's the data you're now using to choose your doctor, right? I think it's a whole different level of assuring that person that this is the right person. So that's like the whole travel desk, right? It's sort of like, here's where I need to go. Can you get me there in the most convenient, highest quality, lowest cost way possible?
And lastly, for the HR audience that's going to be watching this show, if you one word of advice from your end on how can they switch from being an insurance-only benefits provider to an assurance-driven benefits provider?
I think two things. One more practical and then one at a more strategic level. At a strategic level, I think it's starting the conversation with leadership and just their peers to say that, hey, why don't we look at our health benefits in a different way? Right? We are going to spend maybe anywhere between 4,000 to 15,000 rupees per employee this year. I don't spend that much on anything else, right? As an HR. So maybe with that spend, we could find something that's more engaging, that keeps people healthier, that helps them through more of their kind of healthcare issues and concerns over the course of the year than maybe what we've been getting for the last 5 years, right? So I think it's starting that conversation. And then two, I think something they can do right away is understand the health of their population, right? Like partner with maybe a local diagnostic center or hospital for really low cost diagnostic, maybe a few hundred rupees, get a basic kind of blood panel for your team, maybe a basic health checkup, and analyze those results to really show leadership in your team of that, hey, maybe there's these other angles, these other pockets of our population that we need to look at, right? I think when people do that, they might find that there's actually lots of issues and kind of health risks that their employees are dealing with that they didn't even know about. And so that's another way, I think, of like starting down that road of caring about your population health, your employee health.
Thanks so much, Ryan, for being on Close the Loop. And I'm sure that the HR audience will definitely benefit from your views.
Thanks so much. Pleasure.